Hi, I'm Frederick Isasi. I'm the Executive Director of Families USA. We work every day to ensure the very best health and healthcare are equally accessible and affordable to all in our nation. And I want to take a moment to give you a sense of where we think the healthcare movement is going to be going over the next year. The last 10 years have really been focused on a trial by fire for the Affordable Care Act and for Medicaid. And at the heart of it was a central question: would we as a society establish a norm around the notion that we can get sick, get care, and not lose our homes? The most significant efforts we've seen to try to push back against this norm being established really were the repeal and replace efforts of the last couple of years. But it appears we have or are on the cusp of a new norm that guarantees healthcare and financial security to all in our nation. So the question becomes, what's the evolution of the healthcare movement in the United States? As a result of building a more rational and seamless system of coverage and financial security, it brings the question of value, cost, price, and outcomes all together and to the fore of the movement. Because we have such little government involvement in overseeing the value in healthcare, we're at a point where costs, and in particular price, are spiraling out of control. In fact, in today's dollars, healthcare costs have grown 600% in the last 40 years. And as a percentage of GDP, healthcare costs have gone from 6.9% to 18% of our gross domestic product. And frankly, our paychecks have not kept up, particularly for the bottom 99%, almost all Americans. Employers are feeling the pinch. In the last 15 years, the value of the healthcare coverage they're giving to employees has diminished, and we've seen the rate of underinsurance triple, meaning millions of families with insurance have lost financial security if they get sick. In fact, today, more Americans are scared of paying for an illness than actually getting sick. So affordability, rather than simply coverage, has moved into the foreground of the healthcare movement, and that's really at the center of the Medicare for All debate. The election dynamics back in 2018, 40% of Democrats said that healthcare was the #1 issue. That's twice as much as any other issue, and it looks like in 2020 it's going to be a similar dynamic. There's 3 different ways this could go. First, if anti-healthcare candidates are elected, it's very likely we're going to see another effort to take billions, if not trillions, of federal dollars away from making healthcare affordable for our nation's families, either through the health insurance exchange and premium subsidies or through the Medicaid program. There's also another effort afoot. It's really focused on changing the way we pay for, measure, think of healthcare, the transformational effort. It's kind of the middle path. Can we get the financial incentives right so that the system's actually high value and prices is lower? And then the third is really the effort of Medicare for All and others who just want to fight hard to make sure the government gets in there and make sure that prices are reasonable and there's a check on industry charging more and more and more for care. But it's important to mention that there's an unvirtuous cycle at play as well. As healthcare becomes more and more expensive and less efficient, it becomes a larger and larger percentage of our nation's economy. That translates directly into political power. So there are these 2 forces are clashing. For example, you see the Partnership for America's Healthcare Future, where industry is coming together to fight really hard through advertisements and lobbying efforts to stop the government from trying to lower price and make healthcare more affordable. But then you see other efforts like the surprise billing efforts afoot in states on the federal level, or the prescription drug reforms, where the government, Congress, is trying to work hard to rein in out of control prices, either through surprise bills for thousands and thousands of dollars for families, or prescription drug prices that are spiraling out of control. America is different. I'm the child of Cuban refugees. A majority of our nation's children are children of color today, and in 2 decades, we'll be a majority nation of color. And we know we are failing these communities as a nation. Women of color are much more likely to die in childbirth and have their children die during childbirth. African Americans are 50% more likely to die prematurely from cardiovascular disease. People of color are 20 to 50% more likely to experience poor health compared to whites. And the movement is evolving from the right thing to do to an acknowledgement of our shared interest, our collective futures. They all rest on addressing these inequities. And finally, it's really important to discuss all of the important efforts afoot on the state level. Some of these are focused on things like surprise billing or prescription drug costs, but a lot of it's also focused on defending the Medicaid program against efforts by conservative legislatures, governors, and the Trump administration to make it harder for our nation's families to access healthcare through Medicaid. Things like onerous work requirements, paperwork requirements, forcing people to redetermine their eligibility over and over again. There's also some very important proactive work underway in the Medicaid program. It's really aimed at trying to address social determinants of health, change the way we pay for and measure care, address behavioral health, These are efforts that are really trying to improve the program and make sure that the program is really providing health and important healthcare services to families across this country. So as you can see, 2020 is a very important year for healthcare in this country. There's a lot of opportunity. If we have pro-healthcare candidates elected, we could see real progress after the election. If anti-healthcare candidates are elected, we're going to have another fight on our hands. Either way, we here at Families, and I know all of you out there, will continue to fight tooth and nail to make sure that the very best health and healthcare are equally accessible and affordable to all in our nation.